All right, welcome. We are about to take a guided tour of one of the most misunderstood organs in your entire body, the spleen. Now, it might not get the same kind of attention as the heart or the brain, but trust me, it's a totally fascinating and vital part of you. So, let's dive right in. And to kick things off, let me just ask you this. What if you had more than one spleen? Or, get this, what if the one you had could actually wander around inside your abdomen? I know, it sounds like something straight out of science fiction, but these are totally real medical possibilities that we're going to explore today. So here's our itinerary for the tour. First, we're going to meet your mysterious spleen. Then we'll get into its quirks and lookalikes. After that, we'll see the spleen under attack, take a tour of splenic masses, and we'll wrap it all up with why your spleen matters. Okay, our first stop, a proper introduction. We're going to get to know the spleen on a really fundamental level. You know, what it is, what it looks like, and what it actually does all day.
So the spleen is an organ that's kind of tucked away in your upper left abdomen. It's a major player in both your lymphatic and immune systems. And it's basically made of two different parts. You've got the red pulp, which is all about filtering your blood, and then you have the white pulp, which is like the immune system's command center.
And this unique mix of red and white pulp, it gives the spleen this really cool look during certain types of medical imaging. The two tissues actually create a very distinct tiger-striped pattern. It's kind of like the organ's own visual signature. Pretty neat, right? And listen, when we say the red pulp filters blood, we mean a lot of blood. The spleen is basically this massive reservoir. It can hold up to a full liter of blood at any given moment. I mean, that's a huge chunk of your body's entire blood supply, just waiting, ready to be deployed if you ever have major blood loss. You know, if you're looking for a really simple way to think about it, this quote from our source material just nails it. Functionally, the spleen acts like a giant supercharged lymph node. It's constantly checking your blood for any bad guys and filtering out old, worn-out cells. All right, time for our next stop on the tour. We are now entering the world of splenic quirks and variations. We're talking about the congenital oddities that make this organ even more fascinating. Let's get into the weird stuff. Hey, remember that question I asked at the beginning? Well, it turns out having more than one spleen is actually pretty common. It's called an accessory spleen, or, and this is my favorite term, a splenonucleus. It's just a little extra nugget of spleen tissue, and there's a decent chance you might have one and not even know it. Now, most of the time, they're totally harmless, but these little lookalikes can cause some real confusion. A splenonucleus might be mistaken for something much more serious, like a tumor. And here's the real kicker. If someone's spleen is removed to treat, say, a blood disorder, a leftover accessory spleen can actually grow bigger and cause the original disease to come right back. And what about a wandering spleen? Yeah, that's a real thing too. It happens when the ligaments, think of them as the tethers that hold the spleen in place, are just too loose. Without that solid anchor, the spleen can literally wander off to a different spot in the abdomen. And this isn't just some weird party trick. A wandering spleen is at a serious risk of something called torsion, which means it can twist on its own blood supply. If it twists completely, it can cut off all blood flow, causing the tissue to die. That process is called infarction. So that mobility, it comes with some pretty significant danger. Now for our third stop on the tour, the spleen under duress. What happens when this organ is faced with some serious physical trauma or a disease? Well, its responses are nothing short of extraordinary. First off, here's a critical fact. Because of its location and its rich blood supply, the spleen is the most commonly injured solid organ when it comes to abdominal trauma. That vulnerability, plus the fact that it can hold a whole liter of blood, means a splenic injury can be incredibly life-threatening. But this is where things get truly amazing. If the spleen shatters from trauma, it can pull off this incredible act of regeneration called splenosis. Tiny little fragments of the spleen can actually scatter, implant themselves somewhere else in the body, recruit their own new blood supply, and then grow into new, totally functional mini-spleens. It's almost like it can rebuild itself from scratch. How wild is that? We mentioned infarction earlier, when tissue dies from a lack of blood. This is a huge risk for the spleen because its main artery is what's known as an end vessel. The easiest way to think about it is like a road with no exits or detours. It's a one-way street. So if there's a blockage, there's no backup path for the blood to take, and that entire section of tissue just dies, often creating that classic wedge shape you might see on a scan.
All right, for the final leg of our tour, we're going to look at splenic masses. This is all about identifying the different kinds of lumps and bumps that can pop up in the spleen, and, more importantly, learning how to tell the harmless ones from the potentially harmful ones. Let's kick this off with some good news, okay? As our source material points out, the vast majority of masses or lesions found in the spleen are benign, meaning not cancerous. So, while seeing something unexpected on a scan can definitely be scary, the odds are generally in your favor.
So this table breaks down the usual suspects. On the benign side, the things you'll see most often are simple cysts and hemangiomas. Now, when it comes to malignancies, the most common cancer found in the spleen is lymphoma. But, and this is a key difference, the most common cancer that actually starts in the spleen is a very rare one called angiosarcoma.
And what's really interesting is that it's super rare for cancer from another part of the body to spread or metastasize to the spleen. Something about its unique structure seems to protect it. But when it does happen, the #1 culprit is usually melanoma.
Well, we have reached the end of our guided tour. So now it's time to put all the pieces together and really appreciate why this mysterious little organ truly matters. So after all that, after seeing its unique biology, its strange quirks, and its incredible resilience, what's the one thing you should really remember about your spleen? So here it is, the key takeaway. Your spleen is your body's resilient, misunderstood, and absolutely vital bodyguard. It's not just some passive filter. It's an active immune system powerhouse, a critical blood reservoir, and an organ so tough it can literally rebuild itself from smithereens. While it might be mysterious, it's working hard every single day to keep you safe. Really makes you wonder, what other incredible secrets are our bodies